we dovetail now and talk about some of those nutritional interventions that we could start to lay in with clients, particularly years in advance when some of these red flags start to show up. Especially if you work in as a trainer or a strength coach or in rehab and GP and starting to see some of these things. You outline some of the nutritional aspects, things like protein intake, calcium, vitamin D, even creatine. Can you speak a little bit to those different elements and what some targets might be for practitioners or clinicians?
Yeah, definitely. So I think the most important nutrient out of them is probably your protein intake, and it's probably the most well established. Now, older adults at the moment, with those with a decline in muscle health, let's say those populations in care homes, institutionalized, living by themselves in communities, being shown across different populations worldwide that they're consuming around 0.6 grams by their body weight per day to around 0.8 grams per day. Now, the government recommendations pretty much universally all over the world are somewhere around 0.75 to 0.8 grams per kilogram of body weight for protein. But there's various groups that have shown now, again, for the last, since the early 2000s, one group particularly, Stuart Phillips, which should be mentioned, which has done pioneering work in this area, but they've shown that as your muscle gets older, it becomes more resistant to absorbing the protein, and you need a bigger bang for your buck, basically, in terms of protein synthesis to maintain a positive balance of protein in the muscle. So you need a higher intake of protein. And they've shown, we have shown as well, that throughout both epidemiological studies, so looking at people over time, 10, 20 years, 30 years, that take a higher intake of protein, after you adjust for other factors, those with a higher intake of protein seem to preserve more lean body mass or muscle mass. And then in clinical trials, the benefits of protein at starving off the loss of muscle are quite strong. So there's no dispute really that an intake of protein now of about 1.2 grams to 1.5, so really up to could be double the recommended amount by the government. An older adult needs that just to maintain, preserve or regain, let's say, what they've lost in earlier life. So protein take is massive.
Yeah, it's incredible. I had Theo Spoglu on maybe a year and a half ago, and talking, just as you mentioned, around the protein targets for older individuals and the different potential strategies, even around gels or different protein delivery mechanisms to be able to provide some of the boluses in a more sort of convenient and easy to consume manner for particularly older individuals who are in care homes and whatnot, to be able to get that in, because obviously appetite and things like that start to impact that. But it is amazing when you think that the typical client might be consuming less than the RDA, and we're going to need 1.5 to 2 times that to really support this, right?
Absolutely. And when we talk about protein intake, probably the three T's, I like to call them, or I always refer to them in talks during my PhD, is the total amount that an older adult needs, and that's, like I mentioned, nearly double the RDA. So it could be from 1.2 to 1.5 grams per kilogram per day of body weight, and that's what most expert consensus groups around the world, both in the medical world and the physiology world, that they recommend. And then when we look at the type of protein, we know that, again, you get a bigger bang for your buck when it comes from animal sources of protein. Things like dairy products, chicken, meat, lean meats. You get the highest bang for your buck in terms of muscle protein synthesis. And then I think I'm a food first approach kind of guy, but I think supplement industry definitely can target for older adults, because they have issues with malabsorption, they have poor dental health, some of them, their appetites are low, especially when you consider these diagnosed patients that are almost frail and have difficulties walking. We're not talking about a healthy older adult here. And that is where the type of protein can come in. So things like whey protein is very fast absorbing, and again, it maximally stimulates muscle protein synthesis. And one of the key amino acids that you need amongst the whey protein is leucine as well. So your body, there's 20 amino acids out there. nine essential amino acids your body needs from exogenous sources, so in terms of food, and then indigenously your body produces the other 11 out of 20. But one of those key ones out of the nine essential amino acids is leucine, and that's very high in dairy products. So we need to find something that is both palatable for an older adult, something they like, and is convenient as well for these ones that I've mentioned that find it hard to get in to eat foods and to get in this nutrients. And again, touching on dairy products, maybe a bit biased here, but an older adult also needs a higher intake of vitamin D, both for muscle and bone, and calcium as well. So we recommend around 800 to 1,000 IU per day,
Hmm.
and that is to stay above your vitamin D levels of your blood work of 50 nanomoles per liter. That's below there is a deficient level, and that's when you have some problems. So 1,800 to 1,000 IU of vitamin D, along with calcium as well. The International Osteoporosis Federation recommends around 1,000 to 1,300 milligrams per day of calcium. And when you think of a dairy product like a glass of milk, you get a bang in there with protein, whey protein, a little bit of calcium or um, casein. You get a good proportion of whey to casein. You get vitamin D and calcium in that one beverage. So there's a very nutritious package there, dairy products, and I think that might be fortifying dairy products might be a good way forward for those older adults, like I mentioned, which have poor issues taking in foods.